Okay, so we are live. Okay, uh, just waiting for people to join the live session. And yes, we have our first viewer. Yes, I'm late. I'm so sorry. Hi, Amit. Hi, Kshitij. Hi, Neeraj. Hi, Virange. So, to everyone joining this live session, let me start off by telling you that this is a special live session for mental health. And today we will be taking questions from the audience, and whoever is facing any distress due to the current situation or in general can send us our questions related to mental health, and we'll try to answer everything over here. We'll try to specifically focus on anxiety, depression, and self-esteem issues because most of the questions have been related to these three problems. So, I'm really nervous, and I'd like to start off by saying that this is a safe space. So, I request you all not to send anything mean over here. Please don't write mean comments. Please don't bully anyone in the comment section, including the guest who will be joining us today. Please maintain a decorum over here. And yeah, please also understand that it's not possible for us to deal with all the questions in detail. We'll try to keep it as brief as possible, but we'll try to answer everything, including the anonymous questions that we have received. So, an introduction to today's doctor who is joining us. His name is Dr. Rohit Singh. He's a practicing psychiatrist based in Mumbai. He's an amazing psychiatrist, and all his patients have really benefit from the therapy that he's been providing. Hi Sonakshi. Hi to everyone who's joined this session. So I'll just send a request to Dr. Rohit to join us. Just waiting for him to join, and then we can get started with. Okay, what is happening? Yeah. Hi, doctor.
Hi, Ayushee, and hi to all the viewers as well.
How are you, doctor?
I'm doing good. I hope you're doing fine as well in this lockdown.
I'm doing amazing. So, why don't you start off by telling our viewers a bit about yourself?
Yeah, so my name is Dr. Rohit Singh. I'm a psychiatrist and I practice in Juhu, Andheri East in Santa Cruz, basically. And yeah, I've completed my MBBS from Pravara Institute of Medical Sciences, Loni. Loni is not a very known name, but it's 26 kilometers from Shirdi. That's where I've studied my MBBS from, and I've done my postgraduate in psychiatry from KEM Hospital, Mumbai.
Right.
And yeah, and psychiatry is a branch which I'm very passionate about, and I really love my job.
Absolutely.
It does get to me as far as my my timings are concerned, and finding time for myself is concerned. But that's not important, not as important as wanting to love what you really do. So
Absolutely.
yeah, psychiatry, very important branch and really very interesting as well.
Absolutely, doctor. So, for the benefit of our viewers, can you just tell us the difference between a therapist and a psychiatrist so that, people are not confused about this? It's a common confusion which people face. What's the difference between a therapist and a psychiatrist?
Well, both the capacities share a lot of common ground. Okay, so yeah, both of them share a lot of common ground because they have the basic concept of the psyche and personality and dealing with mental health issues. The basic concept remains the same.
Right.
But now therapist has more of counseling to do, talks a lot, takes a lot of time, and takes in a lot of detailed history and tries to implement various methods of psychotherapy and all of that, which also a psychiatrist is able to do as well. In addition, what psychiatrists can do is in the face of acute crisis and in face of acute severe mental illness, where the symptoms present are very dangerous to self as well as others. There, in face of that sort of acute crisis, a psychiatrist can prescribe medications, admit a patient in hospital, take absolute care in the face of that situation, and then probably when that crisis is silenced or quietened down, then probably we can refer a patient for therapy for long-term treatment. That's the
Right.
basic difference. Medications will be
Right.
prescribed by a psychiatrist and not a therapist.
Right. So a psychiatrist can prescribe medicines, while a therapist is someone who solves your issues by talking to you at length
A lot
about
of
your
talking
problems.
needs, yes, and it needs a lot of time.
Absolutely.
So just if I have to cut a long story short, it's something like when in acute crisis, your mind is not very receptive and you're not accepting a lot of things. You are looking at things with a lot of bias lens.
Right.
So you take medicines, you feel a little better, and then you're more acceptable to things and more welcoming. So then
Right.
that's when the therapy comes into picture. And for a
Right.
long-term treatment, then you require therapy.
Okay, okay. Thank you so much, doctor. So starting off our session, the first thing that I want to talk about is stigma in the face of the current situation. We are seeing a lot of people who are trying to avoid, despite of being diagnosed with COVID-19, they are afraid to come forward because there's sort of a stigma which has developed around COVID-19. And it's not only harmful for such patients, but also for the society at large. So what do you have to say about this stigma which is surrounding coronavirus currently?
The first thing I would want to say is it's very sad to really face stigmatization amidst an already sorry situation that the person may be suffering from. First
Right.
of all, it's already a lot of stress to have a diagnosis of
Absolutely.
COVID-19 or to be suffering from that.
Mm-hmm.
But stigmatization will just add to the miseries of people who are diagnosed with COVID-19.
Right.
Now, what is happening is, why is there so much stigma? The problem is this is a virus which is novel. Now, its name itself is novel COVID-19, and COVID-19 stands for coronavirus disease, which originated in 2019.
Correct.
That is the name.
Yeah.
All right. Now, there are a lot of unknowns attached to this infection.
Mm-hmm.
Okay. When we have so many unknowns to a particular thing, you tend to really panic, and it tends to instill a lot of fear in the minds of people.
Right.
And all of us feel very stressful about the fact that, oh my God, we don't know what's going to happen if we
Yeah.
contract this illness.
Yeah.
So it's very dangerous. So the term dangerous is attached to it because of a lot of unknowns related to the infection. That's why people want to desert or ostracize others who are contracting this disease of COVID-19.
Right.
So, and also we tend to then label these patients as coronavirus or COVID-19 victim, COVID-19
Yeah.
suspected case. These names, once we start giving to people, it's going to really make them feel ashamed. It will prevent them from coming forward and seeking help, which in turn will lead to deeper problems in the patient. And patient not coming forward for the treatment means he's going to give it to the others in the society.
Right.
That's why this stigmatization is something which is very bitter right now.
Right. So, since we're talking about stigmatization, don't you feel it's quite similar to the stigmatization that people who deal with any form of mental illness face? Because, there are terms like cuckoo and crazy, which is thrown around like confetti when someone says that they're depressed or they are suffering from something with a mental health problem. So, don't you think it's sort of seeping into COVID-19 as well, this stigmatization of mental health?
Big time. And see, the problem is, I always tell people one thing, I say पेट दुखता है तो डॉक्टर के पास जाते हो, हाथ दुखता है तो डॉक्टर के पास जाते हो, सर दुखता है तो डॉक्टर के पास जाते हो, मन दुखता है तो किसके पास जाओगे?
Exactly.
उसके लिए डॉक्टर के पास नहीं जाओगे क्या? Your मन is also part of you, no? It's also part of your body.
Yeah.
But the concepts or the cultural construct that we have around mental illness, words like mad, the words that you've come up with are pretty cool. But earlier, people find these words very cool, and they want to label people with all of this, all these fancy names.
Yeah.
That is the reason why there is so much stigma around mental illness.
Right.
These are madmen. They have no self-care. They have no families. They are deserted, and they are just roaming around with long hair and very dirty bodies. These are the names attached.
Yeah.
And that is why people are not feeling like coming out with their problems, speaking about it, seeking help. And it's as simple as any other illness. In fact, I would go a step ahead and say, when you have other medical illnesses, you probably would be required to take those medicines over a long period of time, or probably lifelong. But mental illness, you not necessarily need to take these medications lifelong, or you not necessarily need to be in therapy lifelong. It's a matter of 4 to 6 months of very concentrated therapy, and you're fit and fine again to go out and face
Absolutely.
everybody else.
Absolutely.
But that's the conceptual makeup is problematic.
Yeah, so it's a sad thing that our mind, being the most important part of our body, is often the most ignored part. And I hope that with today's session, we'll be able to help a few people. So, moving forward, Doctor, I'd like to start off by talking about anxiety and opening the floor to questions about anxiety, and also asking you a few questions about generalized anxiety disorder. So, my first question to you, Doctor, is how do you identify this anxiety, that you are someone who's suffering from generalized anxiety or any form of anxiety with anxiety disorder? For a layman, can you simplify it, please?
It is something which is you are fearful about, something that you are fearful
Yeah.
about,
Yeah.
but that something remains a something, and you really do not know the cause of it.
Right.
Like for example, if I just cannot go in a crowded place.
Right.
Now, why is this sort of an emotion awakened inside you, that you feel scared of a crowded place?
Right.
You really cannot define a reason why I feel like that, but it's just the feeling. And when I have to call it anxiety, I have to recognize a few, not just the emotional part of it, or not just the psyche part of it, but also anxiety comes along with a lot of physical bodily sensations as well.
It does.
All right, now these are like racing heartbeats and a lot of sweating and tremulousness in voice and tremors of the hand, shivering, butterflies in the stomach, and all that. The entire symptom complex of anxiety is so broad. You need to identify these sensations as well, and when a thought of something strikes these bodily sensations as well, along with the fear component attached to it, that's when it's anxiety, and we need to seek help.
That's a lovely explanation, Doctor. Thank you so much for simplifying it for us. So, as someone who is dealing with anxiety, and a lot of people who have asked me this question, what are some SOS tools to deal with such anxious racing thoughts or an anxiety attack? How to cope with negative thoughts and an anxiety attack when you find yourself in such a situation?
Okay, there can be two components to this. If you ask me, I would want to be a little elaborative about this.
Absolutely.
Now, an anxious thoughts, okay, thoughts which provoke anxiety, and something called as anxiety attack. When we call it an attack, it is something which is very acute and needs instant intervention. Now, nobody else would be present for you. You cannot be around hospital all the time, or you cannot have any help available all the time. In the face of acute crisis, where you feel an attack of anxiety, where you are gasping for breath, or probably you're feeling very, your heart's racing and pounding out of your chest, and all of those things are happening, and you have dryness of mouth, and you feel the fear of impending doom, which is an extreme form of anxiety called as panic. Now, there's no help available for you. You need to be your own first aid, own psychological first aid. Which the psychiatric society has been so insistent upon, that you have to empower your own self with psychological first aid. Now, in the face of that attack, the very first thing that you have to realize and tell yourself consciously, which is difficult, but you have to tell yourself consciously that an anxiety attack comes like a wave and goes.
Okay.
So it's going to peak, reach that peak, stay there for a few moments, and it subsides on its own at times, most of the times. So when it is coming like a wave, I need to just hold myself or just hang in there for those few moments.
Right.
Now, do I just stay there? No. When I have to hold myself there and stay and live that moment or that wave, what I need to do is just be very mindful of my breathing.
Okay.
When you start focusing on something consciously, your focus from other symptoms and the catastrophization that you've created in your mind, the focus from that is distracted, and you're just concentrating on your breath.
Right. Okay.
You're just Now that's a less fearful symptom to concentrate on, rather than my own pounding chest and the tremors in my hand and the dryness of mouth. So when I start doing something like that, I am distracting myself from more catastrophizing, and that's the first thing that I need to do. First thing is I tell myself that it's just a wave and it's going to disappear in a few moments. I just need to hang on. While I'm hanging on, I have to take those deep breaths and try to relax myself. Anything which makes me distract my thought away from those symptoms is the thing that I need to do second.
Okay.
These
Okay.
two things, and it comes with practice, of course. It's not that today we've spoken about it and tomorrow onwards you can master it. It does come with a lot of practice, and every day when
Right.
you start
Right.
doing these things and get into this habit of breathing and all of that, that's when you understand that anxiety attack can still be dealt with. And then once you, even with a slight drop in your intensity, try to talk to somebody. Just try to talk to somebody, and it calms things down. For it to come down to zero is going to take a lot of time, but for it to calm down to a manageable extent takes a few moments, few minutes, not more than a few minutes.
So this can be a friend, a family member, or a therapist if you have one, or a psychiatrist.
Anyone, yeah.
Talking to anyone
Anybody.
helps.
Yes,
Thank you
it
so
does.
much for this. This is extremely insightful. So I have a few questions related to anxiety, which I've received anonymously. The first one says, I can't speak up in meetings. I know the answers, but I can't raise my hands to talk. It was the same way in college, in school, and now at work. I feel scared to talk. I'm scared of being wrong and sounding stupid.
Whenever you are expected to speak or give an opinion in public, let's say for example we're expected to give an opinion, whether it's a meeting or whether it is any other place, be very confident about not yourself, but confident about the message that you have to deliver.
Right.
If that message is going to be helpful to the organization or to the group of people around there, if you're very, very confident about your own intention and your message, there you have won half of the battle. That's the first thing.
Needs to be clear.
Intention.
Yeah.
Very clear, and the message that you are going to deliver.
Right.
Think about them first. Now, when public speaking is concerned, it is not something which is going to happen or click overnight. What you need to do about public speaking is always get into this practice of looking at yourself in the mirror and talking. What happens is you become very sure of the voice quality that you have, you become very sure of the body language that you have, very sure of the articulation that you produce. Right. Gradually, with all these practices, you become more confident, and then you can start delivering things better. It's about the intention in your message and your practice at home. Nothing will come just straightforward to you. You will have to work for things. So public speaking is a lot about practice and a lot about being confident in your intent of speaking.
Right. That's extremely helpful. So basically you have to practice, and be very clear about the message that you want to deliver to the people who are talking to you. Doctor, so sorry for deviating, but we have some lovely viewers who are asking us some questions. We have two questions so far. The first is by Kanish, who says, do lifestyle changes like meditation, exercise, music help to fight depression? That's our first question. And the second question is, how dangerous is mood fluctuation disorder? These are the two questions that we have received so far. Once you answer this, we can move on to the rest of the questions.
Lifestyle changes are the most important resources that we can develop for ourselves in face of any illness. It's not just mental health, but in face of any medical problem as well. Lifestyle modification is the cornerstone of everything that you do, in terms of the diet that you follow, in terms of the habits that you have, which with the habits I mean to say the addictions and the substance use like smoking and alcohol and other substances.
Right.
It's the amount of sleep that you have for yourself, the amount of exercise you give to your body. Now, I really cannot emphasize enough, even if you give me an hour, on importance or significance of lifestyle modification. And yes, they help beating anxiety, they help beating depression, they help boosting your self-esteem, they help building confidence. You name it, and they help with them. Because what happens with exercise, what happens with diet and sleep is, first of all, you're giving enough rest to brain, who needs to rejuvenate every now and then.
Absolutely.
Exercise hits your energy level. Exercise boosts your confidence level. Exercise gives you that peppiness to go out there and perform.
Right.
And once you start working out, once you start following these lifestyle modification, also your own body image about yourself enhances, and that goes on to enhance your self-esteem as a whole. Right. So lifestyle, when I am talking to my patients also, I tell them, I have given you medicines, fine, But you have to combine medicines along with your lifestyle changes. Only then will you see the entire result falling in your favor. It's not just the medicines which will get you out of this. Exercise is equally important. I would say 50 to 60% it's exercise, the lifestyle changes, and 40 to 50% is medicines. That's how it
Thank you
is.
so
Simple.
much for that. So we are moving to the next
Mood
question.
fluctuation.
Yes, mood fluctuation disorder. How
Okay, there's
dangerous
nothing
it
called as
is.
mood. Yeah, there's nothing called as mood fluctuation disorder, first of all. Okay. But we all have mood swings.
Okay.
Let's face this, we all have mood swings, and it is a normal process. It's a very natural thing to feel the highs and lows, not just over a period of days, but even during the day you can have your own highs and lows when it comes to your mood swings. Thing is, when we are talking about mood fluctuation or mood things, these are things which happen to us on daily basis.
Right.
The only thing we need to be mindful of when you're talking about this is when you are in a certain mood state. Now, when you're talking about fluctuation, you are in different states at different times. When we are in a certain mood state, how productive or non-productive it proves out for me and for people around me is
Right.
what is I have to be mindful of. Let's say,
Okay.
for example, I'm very irritable at this point in time because probably things are not going well, too much of traffic, and my boss is not good, had a fight at home, things not going my way. All of that can make me very irritable, very frustrated, and probably I may act out impulsively.
Okay.
Now, fine, my mood state is irritable, but if I act out impulsively, that's the consequence of my mood state.
Okay.
So, what consequence my mood state leads to can be taken control of.
Okay.
If I am mindful, if I have all insight about, yeah, right now I'm feeling irritable, let me take time out. There's something called as time out. Whether I'm depressed, whether I'm irritated, whether I'm very happy, there are times where I can cause trouble for myself also and for people also. So when there is a mood state which I cannot control things, and I know it may cause harm to people, I have to take time out and just let myself be alone for some time.
Not just
When
to
that happens,
others, but to yourself as well, I think, doctor.
but yeah, I can cause harm to myself as well. I can cause harm to my relationship, which in turn harms me.
Yeah.
So I have to take this time out is a very important principle when we are dealing with mood fluctuations. I'm not
Okay.
in a position to talk to somebody because I might just have that temper outburst. Let me not be present around people who might just shoot my temper. So take your time out. When you feel better, come back to the scenario. That's how you deal with your mood fluctuations.
Okay.
And it's pretty simple, yeah. But there's nothing called as mood fluctuation disorder. It's not a disorder.
So I think when she says mood fluctuation disorder, I think she means when the highs and lows are too frequent and they're affecting you too badly, maybe is.
See, there's something called as bipolar disorder, where we are at two extremes of the mood.
Right.
One is extremely sad and depressed. That's called depression. And when we're at the level of ecstasy and extreme happiness, and when we tend to be in a state of mania. So these are the two extremes of a pole. That's why we call it bipolar disorder. Now, bipolar disorder will require medications. All
Okay.
right. It is definitely linked to certain neurochemistry in the brain, and the level of those neurochemicals are a little haywire, and which is why the balance is not right. Hence, to balance out those neurochemicals, we do need medicines.
Right.
At the same time, we need to build up, as therapists, we need to build up the insight in that particular person. You see, this is part of the way you behave is a part of a disorder. It's
Right.
probably not you, it's your disorder which makes you behave that way. So you have to be very mindful of the condition that you have, and along
Okay.
with that, you keep taking your medicines and learn to manage your sad mood, learn to manage your emotions. When these two things are done in parallel, in tandem, that's when the control is really nicely maintained. But then
Okay.
here, I would really want to stress the importance of medications. Things like schizophrenia, things like bipolar disorder, they will definitely require medicines also.
Okay. Doctor, Sonakshi is asking, is mood fluctuation a big symptom of being a bipolar?
Yeah. Yes, that which is why I came to bipolar disorder in context of mood fluctuations. It can be a
Okay.
part of the disorder. That's what I said. It's very important to build the insight in that person. This is probably not you. It's probably the disorder which is making you behave that way. So when you have
Okay.
insight regarding your own condition and why you're behaving that way, you have a better control on these emotions or on these outbursts.
Okay. Okay. Thank you so much, Doctor. I hope that answers your question, Sonakshi. Moving on, we have questions from someone which it says, hey, I wanted to ask how to be productive and actually get work done when mentally and physically you feel fatigued, and what to do in instances when you can't take time out.
Time out in terms of the mood fluctuation?
Yeah.
Okay, let me just wind that part of it. When you can't take time out and when you cannot really disappear from the scenario, the very first thing you need to do is deep breaths. Please, for God's sake, yes, you cannot. For God's sake, I would want you to do this. Take deep breaths. Just look around somewhere. Grab a bottle of water. Try to sip in something. Now, what is happening with this is, first of all, water will calm you down. Deep breaths will calm you down. The very next thing it does is it tends to distract yourself from what's right now happening, and you're not able to stand that. And if you can divert yourself even for about, say, like 3-4 seconds, it's enough. That those 3-4 seconds are enough to halt you from acting out impulsively on your on what you're just about to do. So even those 3-4 minutes gap, it gives you that time to not act impulsively towards the stressor.
Right.
That's about time out. No, not being able to find time out.
Yeah.
The first part of the question is about the
being
mental
productive.
fatigue, and when you are mentally fatigued and you still need to be productive because you don't have a way out.
Yeah.
First things first. When I'm mentally fatigued, what I need to understand, what causes this is there is too much of clutter in the headspace.
Okay.
When there is too much of clutter in the headspace, the information processing is not going to be efficient. Please try to understand this. Too much of clutter in the headspace, the information processing by the brain is not going to be clear, the mind is going to be murky, and the decision making tends to be weaker, probably not as sharp as as that during the times you would expect when you're fresh enough. You need to understand what I need to declutter. You have to get rid of a few things at that point in time. So where comes the most important role of prioritization?
Okay.
I have to get my work done, fine, at any cost. But right now, I'm not in a position to do anything. Just take a 5-minute break, walk around, come back, prioritize first things first. What do I need to do at this moment? So there is something called as something required to do urgently, something that requires to be done immediately, and something which can be done a little later. That's okay if I get it done later. This sort of prioritization, which is called as triage in terms of such pandemic, if I can explain it to you in this context, in triage also there are areas which are red zone and orange zone and green zone. We can relax and where we cannot relax. It's something like that when you prioritize it. Okay.
Correct.
So the most important things will come first. Just do that much. You don't need to do everything at that point in time itself. You don't need to finish off everything right now.
Right.
Break your task into smaller ones.
Okay.
Give yourself sufficient break time also and frequent breaks.
Okay.
Keep evaluating your performances by your own standards and not by standards set by other people. So when you're doing this decluttering, followed by a prioritization, taking an action plan towards one particular task, allotting specific time slots, you start doing small things. That sense of accomplishment starts building the confidence again. It makes you focus again, and you're getting slowly into your own groove.
Okay.
That's how you become productive, even despite being mentally fatigued.
That's extremely helpful. I'll try to do that next time. Okay. So the next question is, lately I've been realizing expectation is my biggest enemy. I give my 100% for the people whom I love, but when it is not reciprocated, it makes me feel unhappy. How do I overcome this?
In relationships, no matter which relationship, friendship, romantic relationship, familial relationship, father-child relationship, siblings, whichever relationship we are talking about, if I am expecting 100% reciprocation, if I'm expecting things to be done to me in return, there's a fault in me.
Okay.
Expectation is the root of all heartache. All the heartaches. Now, this is not me. This is William Shakespeare who said this, but makes a lot of sense in our current scenario also, whoever has asked this question. If I'm doing something in expectation of a reciprocation, then probably that's business, not relationship.
Right.
Let me be very blunt about this. Then it's not you who's doing it. If you are expecting things to happen to you also the way you are doing it for others.
Right.
So be very genuine about your own intentions. You cannot have entire control over how the other person is going to respond to your acts, respond to your deeds, respond to your words. You really cannot control that